In this video, we will talk about powerful intermittent fasting tips for diabetics. I'm a big fan of intermittent fasting. It's a simple and effective way to improve your health, lose weight, and reduce your risk of disease. Intermittent fasting is particularly popular with people who have diabetes because it can help them achieve better control over their blood sugar levels and lower their risk for type 2 diabetes. How to do intermittent fasting. Intermittent fasting is a great way to improve your health, but it can be confusing at first. Here are some tips to help you make the most of intermittent fasting and get the most benefit from it. Eat normally for 5 days. On these days, eat whatever you want and drink water whenever you're thirsty or can't wait. If you find that your hunger is still driving you to eat more than you should, or if this feels like too much food for one day, then try just eating breakfast and lunch on those days and skipping dinner. This will still provide the same benefits as eating normally for 5 days straight, but with less potential side effects, such as feeling full or bloated all day long, or having indigestion after every meal. Fast for 2 days a week. Usually Monday and Thursday work well, where nothing goes into your system except water from drinking glasses throughout the day, or through 4s if needed, until 6 p.m. when they end. Then eat normally until 7 a.m. Tuesday morning when they start again, until 6 p.m. Friday evening when they end again, so there will always be 3 separate periods of 24 hours where no food passes through either mouth nor stomach. Intermittent fasting involves cycling between periods of not eating and eating. It's a practice that has been around for thousands of years, but recently it has become popular again thanks to Dr. Jason Fung's book, The Complete Guide to Fasting, and the Eat Stop Eat Diet by Brad Pilon. It's important to note that intermittent fasting is not a diet, or a fad, nor does it promise quick results or miraculous results in your health. In fact, if you're looking for something that will fix everything overnight, then this isn't the video for you. Those with type 1 diabetes should never consider intermittent fasting alone. It is important to note that diabetics should never consider intermittent fasting alone. If you have diabetes and are looking into intermittent fasting as a way to help manage your condition, talk to your doctor first. Also, when considering IF as a possible treatment option for diabetes, make sure you check your blood sugar levels on a regular basis and keep an eye on your blood pressure as well. Intermittent fasting may help diabetics improve their insulin sensitivity. Intermittent fasting is a great way to control blood sugar levels and may help diabetics improve their insulin sensitivity. However, intermittent fasting is not for everyone. It's important to consider your overall health before trying any type of new diet or eating pattern. If you have type 1 diabetes, this method could put you into ketosis, a state where the body produces small amounts of ketones to burn fat instead of carbs. This can lead to dangerous complications such as dehydration. In addition, it should only be done under medical supervision by a trained professional who knows how to handle these situations properly. If you're on insulin therapy for type 2 diabetes, intermittent fasting may cause low blood sugar episodes, hypoglycemia, when combined with medications designed for controlling elevated glucose levels. It might be best if your doctor monitored these changes before trying IF again. The potential benefits of intermittent fasting include leaner muscles. The potential benefits of intermittent fasting include leaner muscles, lower insulin levels, lower blood sugar and blood pressure, lower cholesterol, triglycerides and body fat percentage. Research has shown that fasting can help people with diabetes to control their symptoms better than usual medication. The following tips will help you start an effective intermittent fasting program. Eat breakfast within 2 hours after waking up. Plan your meals in advance. Avoid all processed foods as much as possible. If you are liking this video so far, please subscribe to our channel so that YouTube can share this video with more amazing people like you. Does intermittent fasting cause diabetes? In a very general way, yes. But not in the way that you might think. Some studies say that intermittent fasting is not a good choice for people with diabetes. This statement was based on the idea that diabetes is a disease caused by too much sugar in your blood, and if you fast then you won't have any sugar in your blood. Therefore, it could be said that intermittent fasting would cause diabetes. However, it has been proven by scientists that this is not true. In fact, many studies have shown that intermittent fasting can help those who suffer from type 2 diabetes manage their symptoms better than other diets. In addition, Several studies have shown that intermittent fasting can reduce the risk of developing type 2 diabetes by up to 60%. There's no doubt that intermittent fasting has benefits. It can improve insulin sensitivity and reduce the risk of cardiovascular disease and diabetes. But there are also some pretty serious risks associated with these types of diets, including dehydration and nutrient deficiencies. If you're going to try an intermittent fasting diet, make sure you're getting enough water and vitamins during your fasting periods so that you don't end up doing more harm than good. The main issue with intermittent fasting is that it may disrupt your circadian rhythm, or the biological cycles that tell your body when to sleep and when to wake up. When you're sleeping, your body produces hormones that help regulate blood glucose levels and prevent insulin resistance, which can lead to diabetes. But if you're not sleeping properly, this process can be disrupted. In addition to disrupting your circadian rhythm, intermittent fasting may also cause stress on your body, as well as increase inflammation levels in your body over time, which can also increase risk factors for type 2 diabetes. So, we suggest that you consult with your doctor first before making the call. Some more tips. Here are some tips for making intermittent fasting work for you. Set up a schedule. Make sure you know when your fast will begin and end so that you're prepared for it. If it helps, write down a meal plan for each day of your fast and stick to it. This will help prevent you from getting hungry or tempted by unhealthy options when you're not supposed to be eating anything at all. Prepare yourself with snacks beforehand. If you know there's going to be an especially busy day ahead of time, stock up on snacks like nuts or dried fruits so that if hunger strikes during your fast, there will be something healthy nearby and ready when it does. Be patient with yourself. This is one of the hardest parts of intermittent fasting, being patient when things don't go exactly as planned. If you're trying something new, be sure to give yourself time to adjust. Sometimes we're so used to eating when we get hungry that it takes a while before we realize we're no longer hungry at certain times of day. It's important not to beat yourself up if things don't go perfectly on day 1 or 2, or even 3. It can take weeks or even months for your body to adapt properly. Be kind with yourself and give yourself some slack. Stay active during your fasting window, even if it's just walking around or doing some light stretches. Make sure you're not fasting on a day you have to work out. It's a good idea to eat before and after your workout, and if you're fasting, that won't be possible. Keep track of how many calories you consume during the day. Keep it under 500 if you want to lose weight. Use intermittent fasting as an opportunity to focus on things other than food, like reading a book or spending time with friends. Listen to your body. If you're feeling hungry, eat. If not, skip it this time around and try again tomorrow morning. Make sure there's something in your fridge that you really enjoy eating so that if hunger strikes while fasting, you'll have something to reach for. Lastly, have a plan before you jump into intermittent fasting. You may ask, what do we mean by this? Having a solid plan will lead you to success, and you will see some amazing results. Make sure to diarize all the details from the start to the end so that you can pinpoint what went wrong and how can you do it better next time. Create a healthy groceries shopping list. Finally, remember that what works for one person may not work for another. Everyone responds differently to different treatments, so keep experimenting until something clicks. Never give up hope on finding what works best for you. We also want to remind everyone that we are not doctors or health professionals. If you have any questions about intermittent fasting, please consult with a doctor or health professional first. If you have any tips for our humble viewers, why not share your tips with us in the comments section down below? Please do not forget to like this video and subscribe.